Hello and welcome to the new series of Drishti IAS. I am Pooja Dwivedi, and in this segment today we are going to discuss about the National Digital Health Mission. This topic is important from the perspective of prelims as well as from the perspective of GS Mains paper 3 and 4. So let's begin with the topics of discussion step by step. First of all, we will talk about Y News, which will be followed by National Digital Health Mission, its features basically. We will also talk about the need of a centralized national digital health ecosystem. We will talk about the advantages related to it, the disadvantages, the way forward, and in the midst of the segment, I am going to ask you a pre-based question. If you know the correct answer for it, kindly comment in the comment segment. So let's begin with why in news, because work on the key components of the National Digital Health Mission, which seeks to create an integrated National Digital Health Database in the entire country, has been ongoing in the Union Territory of Puducherry to provide proper information to health users as well as health providers. Now, if we talk about the National Digital Health Mission, we will go through them one by one, the features of it. I am moving away. You can take a screenshot and I will also further elaborate for you. It says National Digital Health Mission is a complete digital health ecosystem. That means whatever the data related to a health, a person's health, public research on health, every kind of data will be provided in the National Digital Health Mission, which creates an ecosystem. If we talk about its components, it talks about personal health IDs for every citizen, digitization of health records as well as registry of doctors and health facilities across the country. So that means health IDs first. Secondly, it will have personal health records as well, right? Personal health records. And also DigiDoctor. Under DigiDoctor, the doctors across the state hospital or centralized hospital, they will provide their own details as well as contact numbers if they want to, so that they can be easily accessed by different people, different citizens of the country who are looking for healthcare. Alright, so this is DigiDoctor. Then comes health facilities across the country. That means pharmacies, diagnostic laboratories, state hospital, insurance companies. These all will also be included here. That means health facility registry. Alright. So you have to keep these four facilities in mind. First is health IDs, second is personal health records, third is DigiDoctor, and then comes health facility registry. So, if we talk about the implementing agency of a National Digital Health Mission, it's of course National Health Authority, who is also implementing the Ayushman Bharat Yojana, right? So keep this also in mind, National Health Authority, which comes under the aegis of which ministry, you have to tell me in the comment segment. Alright, and also this particular mission will be provided on the app platform as well as website platform, and the scheme would be first rolled out in the different union territories of Chandigarh, Ladakh, Dadra and Nagar Haveli, Daman and Diu, Puducherry, Andaman and Nicobar Islands and Lakshadweep. After a period of time, after such pilot projects have been launched, then the pan-India rollout will also be conducted. Alright, moving on. Let's talk about, if you see the health IDs, we will talk about health IDs in the sense, what does it contain? So if we talk about health ID card, it is a 14-digit unique identification number, which will include the data with respect to every citizen. Suppose diagnostic reports, the summary of previous discharge, ailments, and everything will be given in the health ID cards. And of course, if we talk about e-pharmacy and telemedicine, these are the new tangents of digital health ecosystem. Right now, policy is being formulated for providing telemedicine as well as e-pharmacy to those far-flung away areas which do not have proper public health system. Also, health family registry will also be included, personal health records, and DigiDoctor. DigiDoctor, under DigiDoctor, digitalized signatures will also be provided to the doctors who have enrolled, because this is completely voluntary in nature from the perspective of users as well as providers. So until and unless a person is authorizing the details to be included in the National Digital Health Mission, this won't be a compulsory mission for everyone. So if we talk about DigiDoctor, the DigiDoctors will also be provided signatures which are digital in nature for providing prescriptions. Alright? And if we talk about personal health records and personal health IDs, these are the same in the sense that these will contain proper records of what treatment has been received by the person, and how many reports are there which need to be carried on forward to the next doctor. Everything is given here. Moving on, let's talk about why do we even need a centralized data on national health. First, let's go back to the timeline, how it all started. So, in the National Health Policy of 2017, now this particular policy wanted to create an integrated digital health ecosystem to make sure that the need of all these stakeholders are met, and also improvement in efficiency of treatment, transparency, accountability, and a very good experience should be there from the perspective of the citizen of one country, of our own country. So National Health Policy wanted to make digital health ecosystem in this sense. And it said that a digital health ID which was proposed under National Health Policy of 2017. It proposed to greatly reduce the risk of preventable medical errors and hence significantly increase quality of care. So whatever medical errors could have been made manually, the National Digital Health ID was proposing to mitigate and if not completely rule them out, then at least get them to a minimum extent. The problems which are actually preventable in nature can be mitigated, and hence what will happen? The proper treatment will be provided to the person, to the patient, and of course then it will increase the quality of care. And after that, a national health stack was also floated by the think tank Niti Aayog in the year 2018. After a National Health Policy of 2017, we come to National Health Stack. Now, what did it want to do? It wanted to digitize the health records and provide proper guidance to the insurance agencies. In the sense, a public health insurance would be provided under the digitized ecosystem and also take into account the diverse public health system in our entire country, uniqueness of the public health system of our country, and also political realities of our federal structure. So this was the National Health Stack's aim. And if we talk about it, then digital infrastructure, it was built on the aim of making the health insurance system more customized and more transparent plus robust. Then after that, a committee which was headed by the Unique Identification Authority, UIDAI, this was formed and it suggested a National Digital Health Blueprint in July 2019. Now this particular committee proposed that a specialized agency, National Digital Health Mission, should be made in order to digitize an integrated public health data. So from here we started with our proper journey of National Digital Health Mission. It said that after that on 7th August 2020, National Digital Health Mission released its latest strategic document outlining the envisioned digital registries of doctors, hospitals, pharmacies and insurance companies, digital personal health records and digital clinic decision system. So if we talk about it, then this particular step, if handled well, will be very significant in revolutionizing our public health infrastructure. and it will also encourage research in the public health infrastructure. It will increase the quality of care and also the precision. It will also make sure that it is well updated in the sense to see where the disease lie, where the hotspots of particular disease lie, and what are the social and demographic correlation with respect to a certain disease. And after an integrated data will be collected, then policies will be more robust, more precise and more effective. So that is the significance and need of an integrated national digital data when it comes to health. If we talk about what are the advantages, we will go through them one by one. First is it is extremely advantageous to the patient, very convenient to the patient. The patient needs to carry almost 4 to 5 reports, different reports, when going from one doctor to another doctor and another doctor. So in that entire process, so many documents, it is very difficult to collaborate for the doctors as well, corroborate for the doctors as well, and for the patients as well, how to deal with so many documents in manual form. So if we talk about the National Digital Health Mission, the entire document will be stored, and because of that, it will be very convenient for patient and it will be hassle-free for the patient to show the digital health records to the next doctor and so on. Alright? And reduce overall expenses. Many a times it has happened that a person going from one doctor to another has to repeat all the treatments and tests once again. So in order to reduce that, in order to take care of that as well, because if you are going to repeat tests over and over again, the same tests, what will it cause? It will cause first your peace of mind, and second it will burn a hole in the pocket of the patient as well. So this will also be a big advantage when it comes to expenses. And also efficacy of treatment will be increased because all the data that has been registered, that has been there in the data. What will happen? Because of that, every doctor the patient chooses will be able to see what kind of treatment the patient was receiving and was the treatment that the person receiving was correct or not. So it will also increase the efficacy of treatment as well as accountability on the parts of health facilities and doctors. Also, it will streamline the quality and accountability. Now, this is an offshoot of this particular advantage. And health insurance policies, because all the other proper institutions related to the health infrastructure such as pharmacies, laboratories, health insurance agencies, every agency will be included under National Digital Health Mission. So health insurance policies will be more customized as well as robust in nature, because one size doesn't fit all when it comes to public health structure in our country especially. So health insurance policies will be more customized in accordance to the needs of the patient. That is also an advantage. And also because of e-pharmacy and telemedicine, all these facilities will be also provided in the rural areas at a later stage. The public health system in our country is already, when it comes to rural areas, is already in a dilapidated condition. So this is advantageous. This is an advantageous step for the rural areas as well. Now let's talk about the disadvantages. So in the absence of proper laws and regulation, the data which has been provided under the National Digital Health Mission have chances of misuse by private sector and diagnostic laboratories, pharmacies, as well as insurance companies. So a proper structure when it comes to the legal provisions should be made in order to reduce the chances of misuse of the data available. And ethical breaches and breaches of privacy, then issues related to stigmatizing a particular disease when it comes to be known through the National Digital Health Mission. This is another problem. And also quality of records maintained in the sense that whatever the details have been provided are correct or not, they are complete or not. So these are another problems that National Digital Health Mission needs to take care of, because if the proper information is not available or the information available is incomplete, then it will do more damage than good to the patient and the entire public health infrastructure. Of course, if we talk about the budget right now, according to the NSS of National Sample Survey of 2017 and 18. Now, if we talk about that, 66% of the healthcare infrastructure is being taken care of by the private health sectors. And if we talk about the expenditure on public health infrastructure by the government is just a little above 1%. If we talk about the total health infrastructure expenditure, it is 3.6% from the perspective of both government as well as private industry when it comes to health infrastructure. So if we compare this with other countries such as Canada and Australia, Canada spends 8% of its GDP and Australia spends 6.3% of its GDP on the public health infrastructure. So until and unless the revamping of the entire public health infrastructure, the increment in the budget when it comes to budget allocation from the point of view of public health infrastructure is not there, then how we will properly execute the National Digital Health Mission, that is also a very big challenge. And of course, if we talk about the way forward, first way forward we need here is digital literacy. Until and unless the rural areas and most of the urban populace is not literate digitally, how will they reap the benefits of this scheme? Then of course health literacy and knowledge in the sense, according to the National Sample Survey, it was seen that most of the ailments go undiagnosed because of lack of health literacy as well as knowledge. So until and unless that is increased, we can't make benefits through this particular mission. So that needs to increase so that self-reporting is more robust and more efficient. And also revamping of public healthcare system. The government needs to do expenditure more on the healthcare infrastructure in the public arena. Also, human resources should be developed. There should be proper human resources available. For that, expenditure is must. And if we have already compared it with the expenditure from the perspective of Canada and Australia, so that is also needed. And a clear framework and pathway on ways to bring the private industries in the healthcare infrastructure is also needed. Because if we talk about that, it is not a very lucrative deal for private industries, right? And their inclusion in the Ayushman Bharat is also very low. So that is a big challenge, how to bring them into confidence so that they can be a part of National Digital Health Mission and then of course give benefits to the patients and citizens of India. So as for now, I am concluding the piece, but before we go, we need to ask you a prelims-based question. So you have to tell me in the comment segment. First, when was Ayushman Bharat launched? Second, which two schemes has it subsumed? Alright, so that's it for today. Tomorrow we shall meet again with another segment. Until then, stay updated and thank you so much for watching.